Good morning. In this chapter today we will discuss about therapeutic incompatibility. We will discuss about the therapeutic incompatibility. What is therapeutic incompatibility? What are its causes? We will take different examples to understand what is therapeutic incompatibility, how to correct it. We will discuss it in English and also in the later part we will discuss it in Odia also. So we will start with this therapeutic incompatibility. So first of all, what is therapeutic incompatibility? Therapeutic incompatibility may arise as a result of prescribing certain drugs to a patient with the intention of producing a certain degree of pharmacological action, but the nature and intensity of action produced is different from that is intended by the prescriber. Now, suppose a patient is suffering from a disease. Now he went to the physician has written certain medication. Suppose the patient is suffering from fever, elevated body temperature. Now he went to the prescriber has written certain medication. Suppose he has written paracetamol 500 mg. Now what is the work of paracetamol? It is an NSAID group of drug, non-steroidal anti-inflammatory group of drug. It will reduce the pain, it will reduce the body temperature and also it will reduce inflammation. Now as the patient is suffering from fever, elevated body temperature, so what is the work? It will reduce the elevated body temperature. Now without reducing the elevated body temperature, the drug may result in allergic manifestation in the patient. It may result in severe gastric irritation or vomiting, whatever it may be. That is different from the intended pharmacological action. So why the prescriber has prescribed those medication? He has prescribed those medication in order to reduce the fever, in order to reduce or in order to decrease the elevated body temperature. Now what type of action is produced here? Here there is allergic manifestation. There may be vomiting, may be severe gastric irritation. That is not intended by the prescriber. This is known as therapeutic incompatibility. Whenever a prescriber prescribing certain medication to a patient with the intention to produce a specific degree of pharmacological action, but the nature and intensity of action is produced that is different from which is intended by the prescriber. Prescriber intend to reduce body temperature, but here there is allergic manifestation and also there is or there is severe gastric irritation which is not intended. Therefore it is known as therapeutic incompatibility. And why this is known as therapy? As it is therapy, from the word therapy, the therapeutic incompatibility is there. Therapy means treatment. So in the treatment course this incompatibility arises. Therefore this is known as the therapeutic incompatibility. There are certain reasons, certain causes of therapeutic incompatibility. What are the causes of therapeutic incompatibility? These are the 5 different causes of therapeutic incompatibility. Error in doses, wrong dose or dosage form, contraindicated drugs, synergistic and antagonistic drugs, drug interactions. So these are the different causes of therapeutic incompatibility, the 5 different causes. Error in doses, wrong dose or dosage form, contraindicated drugs, synergistic and antagonistic drugs, drug interactions. We will discuss one by one. So first of all, what is error in doses? The most serious type of error in doses is prescribing overdose of a medication. This is the mistake. What is the most serious type of mistake arises? That is prescribing overdose of. Why this arises? Why error in doses is there? Because of the error in doses. From where this error in doses arises? How error in doses is there? Because of during writing the prescription or during interpreting the prescription, error in doses is there. And most serious type of error in doses or mistake arises is the prescribing overdose of a medication. This is the most serious type of error in doses. Therefore, the prescription before dispensing must be thoroughly checked by the pharmacist in order to avoid error in doses or in order to avoid any prescribing or dispensing overdose of a medication. We will take an example. A prescriber has written codeine phosphate 0.5 gram, prepare 10 powder. Here the pharmacist has to dispense codeine phosphate 0.5 gram, that means 500 mg. So the dose of the codeine phosphate is actually 5 mg, 5 milligram. But here the prescriber, by mistake, he has written that the dose of the drug is 500 mg, 0.5 grams. So it is a overdose. It will produce very serious consequences. So the prescription will be referred back and it must be corrected because dose is 5 mg here. So this is known as your error in dosage. Next is wrong dose or dosage form. There are different drugs which are available in the market having nearly similar names. Therefore, there may be mistake that will be happened during writing or during dispensing the medication. Like the different drugs are prednisone, prednisolone, nearly similar names. Indocin, linosin, nearly similar names. Digoxin, digitoxin, nearly similar names. Therefore, the actual drug should be prescribed or the actual drug should be or medicament should be dispensed. Dosage form. Same drug is available in different dosage forms. Tablet form, the solid dose form, liquid form, injectable form. Same drug. Suppose paracetamol. It is available in both tablet form. It is available in the suspension form or syrup form. It is available in the injectable form. Now suppose a 2-year child is there. Doctor has written only paracetamol. He has forgotten to written the dosage form. Now, if the pharmacist is dispensing here tablet, it is very difficult for the child to swallow the tablet. Now, therefore, dosage form must be properly mentioned. In that case, we have to dispense syrup form. Or if the patient cannot swallow the medication, now we have to administer the drug in the injectable form, that same paracetamol in the injectable form. So therefore, dosage form should be correctly or properly mentioned. Otherwise, it results in therapeutic incompatibility. Next is contraindicated drugs. Contraindicated. Contra means opposing. Indication means the use of the drug. That means it is against the mentioned use of the drug or specific use of the drug. So, there are certain drugs which are contraindicated in certain patients who are having allergic to it. Like the drugs are sulfa group of drugs, like penicillin. Those are contraindicated in patients having allergy to it. Likewise, corticosteroids are contraindicated in patients having an active peptic ulcer disease. So, these corticosteroids should not be dispensed to patients with peptic ulcer. Otherwise, it will lead to severe gastric irritation. It is a therapeutic incompatibility. Likewise, penicillin, sulfa group of drugs should not be administered to patients with having allergy to those drugs. Next is synergistic and antagonistic drugs. Synergism, two or more drugs given in combination, action is increased. That phenomenon is known as synergism and the drugs are known as synergistic drugs. Two drugs we are administering, action is increased, phenomenon is known as synergism, drugs are known as synergistic. Likewise, what is antagonism and what is antagonistic drug? Two drugs given in combination, one drug opposes the action of another drug, the phenomenon is known as antagonism, drugs are known as antagonistic drugs. Now, synergism or what is synergy? So here, the prescriber has written amphetamine sulfate 20 mg, ephedrine sulfate 100 mg and syrup up to 100 ml. They will produce additive effect. However, the dose of the drug is very high. Therefore, it should be corrected. Dose must be reduced. Then only it should be dispensed. This is antagonism. Two drugs given in combination, one drug opposing the action of another drug. Phenomenon is known as antagonism. Drugs are known as antagonistic drugs. A prescription is containing acetyl salicylic acid 0.6 gram, probenecid 0.5 gram. Both acetyl salicylic acid and this probenecid are used in the treatment of gouty arthritis. But when they are given alone, when they are given in combination, acetyl salicylic acid is opposing the action of probenecid. Probenecid is opposing the action of acetyl salicylic acid because of antagonism. So these are the antagonistic drugs. So the prescription must be corrected and dispensed. Next is drug interaction. When drug interaction arises, when the action of one drug is altered or changed, by prior or simultaneous administration of another drug or food, the phenomenon is known as drug interaction. The action of the drug is changed by prior or simultaneous administration of another drug or food, then the phenomenon is known as drug interaction. A prescription is containing tetracycline hydrochloride 250 mg and send 10 capsules, and direction is to take 1 capsule every 6 hours with milk. But tetracycline interacts with calcium. Tetracycline should not be administered with calcium because there is an interaction occur between tetracycline and calcium. Now here the drug should be administered with milk containing calcium. So there is an interaction occur between tetracycline and the calcium present in the milk. So tetracycline should not be dispensed with milk. So again we will discuss it in Odia. Therapeutic incompatibility कौन? जितने गोटे प्रेस्क्राइबर प्रेस्क्राइब कर सर्टेन ड्रग्स किसी ड्रग गोटे पेशेंट को इंटेंशन कौन गोटे स्पेसिफिक डिग्री ऑफ फार्माकोलॉजिकल एक्शन प्रोड्यूस्ड होबो पेशेंट से मेडिकेशन गुड़ा नवा द्वारा. सपोज पेशेंट इज सफरिंग फ्रॉम फीवर इज प्रेस्क्राइबर लिखिचंदी कोन पैरासिटामोल खाइले फीवर विल बी रिड्यूस्ड, किंतु फीवर रिड्यूस होवा जगह कोन हला गैस्ट्रिक सिवियर गैस्ट्रिक इरिटेशन इज देयर और वॉमिटिंग हला सिवियर वॉमिटिंग और एलर्जिक मैनिफेस्टेशन हला. एटा कोन इंटेंशन टा कोन थला प्रेस्क्राइबर को प्रेस्क्राइबिंग का इंटेंशन थिला फीवर रिड्यूस होबो टेंपरेचर जो बढ़ी छे सेटा कमिबो, किंतु हला कोन गैस्ट्रिक इरिटेशन और वॉमिटिंग जो गुड़ा कि दैट इज नॉट इंटेंडेड बाय द प्रेस्क्राइबर. एटा कहउछु कोन थेराप्यूटिक इनकम्पैटिबिलिटी. थेरापी माने कोन ट्रीटमेंट. जेतु ट्रीटमेंट कोर्स रे इनकम्पैटिबिलिटी अराइज करछि, देयरफॉर द नेम इज थेराप्यूटिक इनकम्पैटिबिलिटी. देयर आर 5 डिफरेंट रीजन, पांचटा कारण रहिछि थेराप्यूटिक इनकम्पैटिबिलिटी. एरर इन डोजेस, रॉन्ग डोज और डोजेस फॉर्म, contraindicated drugs, synergistic and antagonistic drugs, और drug interaction. So first in error in doses. Error in doses केतेले हुए? The mistake arises during writing the prescription or interpreting the prescription. Mistake टा केतेले हुए? Prescription लेखिबारे किबा ताको interpret करिया संगरे एई mistakes टा arise करे error in doses. Prescriber लेखिचंदी कोन codeine phosphate 0.5 ग्राम 10 powder we have to dispense. Codeine phosphate रो डोज टा केते 5 mg. इति लेखा हिचे केते 500 mg. So it is a serious overdose. So it should be referred back. Prescriber prescription टा correct करके आउथरे it should be dispensed. Wrong dose or dosage form. किसी ड्रग अछि जोडा कि नियरली सिमिलर नेम्स लाइक डाइगोक्सिन डिजिटॉक्सिन, प्रेडनिसोलोन, इंडोसिन, लिनोसिन. सो ए केस रे कोन करेक्टली लिखिबा दरकार ड्रग टा, अदरवाइज देयर मे बी मिस्टेक. डोजेज फॉर्म सेम ड्रग टा अवेलेबल होची टैबलेट फॉर्म रे, सिरप फॉर्म रे, इंजेक्टेबल फॉर्म रे. पैरासिटामोल टा अवेलेबल होची टैबलेट फॉर्म रे, पैरासिटामोल टा सिरप फॉर्म रे, इंजेक्टेबल फॉर्म रे. जदि गोटे छोट छुआ को हम पैरासिटामोल लो टैबलेट दबा, छोट छुआ दे कैन नॉट स्वालो, से स्वालो करि परिबो इजीली. एति पई से केस रे हम कोन करिया दरकार, हमको सिरप दबा दरकार. गोटे पेशेंट स्वालो करि पानी, हम जे ताको टैबलेट दबा से स्वालो करि परिबो, तेनु ताको कोन करिया दरकार इंजेक्टेबल दबा. So dosage form must be correctly written. Contraindicated drugs. किसी ड्रग अछि जोडा कि अपोज करछि किसी डिजीज कंडीशन रे से माने अपोजिंग एक्शन देखैबे. लाइक कॉर्टिकोस्टेरॉइड्स आर contraindicated in patients having active peptic ulcer. Peptic ulcer थिला पेशेंट यदि हम कॉर्टिकोस्टेरॉइड्स देउछु सिवियर गैस्ट्रिक इरिटेशन हो, काहे कि contraindication is there, contraindicated. सल्फा ग्रुप ऑफ ड्रग्स, पेनिसिलिन ग्रुप ऑफ ड्रग्स. किसी पेशेंट कर पेनिसिलिन और सल्फा ग्रुप ऑफ ड्रग को एलर्जिक कंडीशन, एलर्जिक मैनिफेस्टेशन हे परते से मानन को सेटा करबा उचित नहीं. लाइक साइनर्जिस्टिक एंड एंटागोनिस्टिक किछि ड्रग अछि जोडा को हम कॉम्बिनेशन देउछु, एक्शन बढ़ुछि ताला हम कोडा साइनर्जिस्टिक ड्रग. एक्शन कमिले एक्शन ता अपोज करछि, गोटे ड्रग आउट ड्रग एक्शन को अपोज करले सेटा कहला एंटागोनिस्टिक ड्रग. एई प्रेस्क्रिप्शन रे कोन होछि ड्रग डोज ता बहुत हाई रहिछि, एडिटिव इफेक्ट देखै एम्फेटामिन सल्फेट एफिडिन सल्फेट, किन ड्रग डोज जे तो हाई रहिछि त ड्रग ता को रिड्यूस करिके हम ताको प्रेस्क्राइब करिया. नेक्स्ट इज एंटागोनिज्म. एसिटाइल सैलिसिलिक एसिड, प्रोबेनिसिन दुईटा को यूज होछि गोटी आर्थराइटिस ट्रीटमेंट रे, किंतु एतले कॉम्बिनेशन रे दिया होछि कोन होछि एसिटाइल सैलिसिलिक एसिड अपोज करछि प्रोबेनिसिन को, प्रोबेनिसिन अपोज करछि एसिटाइल सैलिसिलिक को. एंटागोनिस्टिक ड्रग्स दे एंटागोनिज्म अराइजेस. नेक्स्ट इज ड्रग इंटरैक्शन. जतले गोटे ड्रग ता तार पूर्वरु किछि ड्रग और खाद्य किंबा ता सहित नवा द्वारा एक्शन ता तार चेंज हो जाय और अल्टर्ड, सेटा कोन कह जाय ड्रग इंटरैक्शन.